The Ministry of Health and Wellness says it will be providing a detailed report to the nation about the status of the more than 100 ventilators in the public health sector. It follows the opposition People's National Party's inquest into donated ventilators provided during the COVID-19 pandemic. As Jamaica Maitland reports, the opposition's theory is that while the ventilators were donated, they remain largely inoperable because of the lack of training for public health care workers to use the machines.
Opposition spokesman on health and wellness Dr. Alfred Dawes continued to press the government on the status of the ventilators at public health facilities across the island.
So we know that many of these ventilators are in boxes, they're not commissioned, or they have been cannibalized where one part has been taken from a ventilator to fix another ventilator that is not working.
TVJ News could not ascertain how many ventilators are at specific hospitals or whether they're functional, but the Ministry of Health and Wellness said all ventilators donated to the government as part of the country's COVID-19 response are accounted for. 6 ventilators were donated to the Southern Regional Health Authority, 8 to the Western Regional Health Authority, 23 to the Southeast Regional Health Authority, while the Northeast Regional Health Authority received 5 ventilators. The University Hospital of the West Indies also got 12. Dr. Christopher Tufton said a more detailed report will be provided.
My team and I are going through the statement by the opposition and will provide a fulsome response on the issue. The issues around ventilators, given the public interest, we have done the audit and can provide better particulars on that and will provide better particulars.
Prime Minister Andrew Holness also called for an audit into the donated ventilators. During a press conference Wednesday morning, Dr. Alfred Dawes welcomed the announcement.
It is a start, but it should not be as a result of a crisis that we're asking how many ICU spaces, how many HDU spaces we have in the country.
The probe follows the death of a newborn baby at the Maypen Hospital in Clarendon earlier in June. The baby required the life-saving machine in order to breathe. However, there was no functional one at the facility. According to the Ministry of Health, the baby was receiving manual ventilation and was being prepared for transfer to the Bustamante Hospital for Children in St. Andrew, but it was too late. The Children's Hospital is one of 6 health facilities that is part of the Program Reduction for Maternal and Child Mortality PROMAC that received equipment for the development of the neonatal high-dependency units. The units are expected to reduce instances of deaths related to childbirth as well as deaths of newborns. Jamaica Maitland, TVJ News.